Hey lovely people, it's your girl here, Christabel Biaki, a clinical nutritionist by profession. I'm going to go through a little session on dietary management of diabetes. So when you talk about diabetes, we need to start looking at the definition of diabetes. So diabetes basically is when you have higher than normal blood glucose levels. So there are different types of diabetes. We have type 1 diabetes and type 2 diabetes. So with type 1 diabetes, which is normally called by other words as insulin-dependent diabetes mellitus, is when your pancreas, there's normally an organ in your body called pancreas that is responsible for producing insulin. So when your pancreas produces either little or no insulin at all, so that's why someone becomes insulin dependent to be able to manage their blood sugar levels. We also have type 2 diabetes called also called non-insulin dependent diabetes mellitus. So in this case, we find that the insulin is produced, but it's either insufficient or the body cells are not they're not responsive to insulin response, so they become resistant to your insulin. So they're not able to take up the insulin for the glucose to go into the cells, so you'll find that your blood sugar levels are still high. We also have another type called gestational diabetes. So this mostly happens in pregnancy. So for most people, you find that it will resolve after the pregnancy is over, but for some it may still persist even after childbirth. Yeah, so there are various predisposing factors to one getting diabetes. You normally have the modifiable factors. These are what you can work on, and you have the non-modifiable ones. Non-modifiable ones are those that are beyond our control. So non-modifiable factors are like your age. You find that with age, your chances of getting diabetes also go high. But nowadays, we find cases of even infants and young individuals getting diabetes. We also have gender, we also have race, and we also have the non-modifiable factors such as physical inactivity and being overweight or being obese, which also increases your risk of insulin resistance. So basically, we also have complications that may come about from being diabetic. So such complications are like kidney issues. You may get kidney failure. You may have heard of people on dialysis who need to go do dialysis to be able to handle their kidney issues that have arisen from diabetes. We also have diabetic retinopathy, where your eyesight can also be affected. You might experience blurred vision. We also have diabetic peripheral neuropathy, where you find that you have nerve pains and then you lack the sensation. So you might not be sensitive to pain or heat because your nerves have been affected. We also have heart disease that may also come about. Hypertension may also come about as a result of diabetes. So those are some of the complications that may come about, especially if you don't manage your diabetes well. At least if you manage it well using your medication, your insulin, and using diet therapy, you'll be able to avoid those complications. And even if they come about, you'll be able to handle them better and prevent deterioration of the same condition. Yeah, so we're going to look at the dietary management of now diabetes. So when you're looking at dietary management of diabetes, basically you're looking at being able to feed in a manner that it will not lead to a very sharp rise in our blood glucose levels. So basically, when you're looking at dietary management, you're looking at glycemic index as a key factor. So you need to look at the glycemic index of the foods that you're eating. Basically, glycemic index is the ability of a food to raise your blood glucose levels and elicit an insulin response. So basically, you are targeting low glycemic index foods, which will not lead to such a sharp rise in your blood sugar levels. So basically, we have different kinds of food and different categories. So with low glycemic index foods, we're looking at foods like whole grains. We're looking at whole grain bread, whole grain pasta, brown rice instead of the white rice. We're looking at vegetables. We're looking at tubers like sweet potatoes, arrowroots, cassava, and such like foods which may not lead to such a sharp rise in your blood glucose levels. When you're looking at fruits, you need to be careful. You need to go for those that are low in glycemic index. For example, going for an apple and such like fruits which not raise your blood sugar levels very high. When you're looking at the high glycemic index foods, now for these foods you need to avoid them. We're looking at things like cakes, we're looking at things like sugar, cookies, which will raise your blood sugar levels at a very fast rate, like white rice and such foods, white bread. So those are some of the foods that sodas that will raise your blood sugar levels very high. So you need to be very keen on your caloric intake. So basically, you need to see someone who might guide you, preferably a nutritionist or a dietitian, who will take your weight, your height, get your body mass index, and be able to advise you on your caloric intake and the different servings you're supposed to have as from each food group, and the type of food that you're supposed to eat, which will not raise your blood sugar levels very fast. So we also need to be keen on our food timing. We need to have regular meal times as much as possible so that you don't fluctuate much in terms of your feeding. You also need to avoid skipping meals. Remember, when you're diabetic, you also risk going to hypoglycemia. Hypoglycemia is when your blood sugar levels go very down, very low, lower than the recommended levels. So basically, if you skip your meals, you risk going into hypoglycemia. So you also need to be keen on that. Then your meals need to be small but frequent, spread out throughout the day rather than having large meals at one sitting, because the problem with having large meals at one sitting is that it may also raise your blood sugar levels very fast, which is also not ideal. Then you also need to avoid, of course, the intake of the refined foods. The refined foods are the ones that have their fiber removed. So when their fiber is removed, you find that it raises your blood sugar levels rapidly, because what basically the fiber will do is that it will delay the digestion and absorption of glucose into the blood, such that it doesn't lead to a sharp rise in blood sugar levels. So you need to avoid the refined ones. You need to avoid the processed foods, the sugary foods and drinks. You need to also avoid all these foods that are also high in fats, added fats, saturated fats and sugars. We need to avoid the deep fried foods, and also need to minimize on our fat intake. We need to also be keen on physical activity. As we said, physical inactivity is also a key factor in predisposing us to getting diabetes, hypertension, all these other non-communicable diseases. So we need to at least do regular exercise. When you mean the regular, you need to do at least 30 minutes of exercise on a daily basis that makes you sweat. So there are various forms, both aerobic and anaerobic exercises that you can also engage in, of course, with the direction of your doctor as well, because physical fitness is also key in determining the type of physical activity that you're supposed to engage in. You also need to avoid alcohol intake. You also need to avoid smoking, amongst other lifestyle modifications. Yeah, so it's basically something that you can manage with the right treatment regime, and also with the right lifestyle modifications. You can be able to keep your blood sugar levels at the recommended levels. Thank you so much for your time.